This is the supervised toothbrushing training for self-funded schools and nurseries. The information in this training has been sourced from the 2016 Public Health England guidance document, Improving Oral Health, Supervised Toothbrushing Programme Toolkit. It is requested that early years and educational settings run the scheme as detailed in this programme and in line with evidence-based Public Health England guidance, rather than implementing their own systems. The aim is to provide the relevant information and support needed to enable staff to deliver an effective supervised toothbrushing scheme. The Toothbrushing Programme is a nationally recognised evidence-based oral health initiative for children, which is designed to improve children's oral health, increase exposure to fluoride, promote behavioural and self-care skills. Designing your own supervised toothbrushing programme. It is a requirement to designate a lead person who will be responsible for gaining consent from parents, recording and monitoring staff training, ensuring cross-infection guidelines are followed, ordering stock, carrying out quality assurance assessments at an agreed frequency and documented on a checklist. Consent. Consent forms must be supplied to all parents. Only children with consent can take part in the programme. Toothbrushing. This should be organised in a safe and effective way, which is integrated with nursery, school and home routines. It is important that children are encouraged to brush teeth twice a day at home. Toothbrushing can be carried out in groups or individually, and children can be seated or standing. It should be completed at an appropriate time for your class, and children should be encouraged to brush their own teeth using a method which is appropriate to the child. Although it is not recommended to brush straight after food or drink, it is acceptable for schools and nurseries to fit in toothbrushing around routines and implement at a suitable time. Toothbrushes. When sourcing the toothbrushes, ensure that they are appropriate to age and ability, individually identifiable for each child, replaced each term. For older children, adult brushes may be used, but these must be stored in ventilated containers. Toothpaste. Regular daily toothbrushing with an appropriate fluoride toothpaste is highly effective in preventing dental decay. Toothpaste must contain at least 1,350 parts per million fluoride. A smear of toothpaste is used for children under 3 and a pea-sized amount for children aged 3 and over. Children are discouraged from swallowing toothpaste during and after brushing. Once brushing is completed, children should not rinse, and any excess toothpaste can be wiped away. Cross-infection. Toothpaste must not be applied directly to each child's brush. Pea-sized amounts of toothpaste should be placed on either a paper towel or plastic plate and then onto the toothbrush. There must be sufficient spacing between the quantities of toothpaste dispensed to allow transfer to each child's brush without cross-contamination. Toothbrushes must not be soaked in bleach, cleaner or disinfectant. After toothbrushing, brushes are to be rinsed thoroughly and individually under cold running water and placed in the storage system to allow them to air dry. Toothbrushes should not be washed together in the sink and should not touch the taps or sink when being rinsed. Toothbrushes must not be soaked in bleach, cleaner or disinfectant. Toothbrushes must be stored upright in storage racks, which are designed to allow enough distance between toothbrushes to avoid cross-infection. The storage rack must have a designated space for each child's brush, which should be labelled and identifiable for each child. Storage systems must not be kept in toilet areas and must be kept out of reach of children. Storage systems should have lids, which must be used at all times. Storage systems need to be wiped daily to remove any drips. Storage systems should be cleaned weekly with household detergent and warm water. Designated household gloves should be worn and all cuts and abrasions covered with a waterproof dressing. Storage systems should be replaced if they become cracked or damaged. Stock required. Supervised toothbrushing supplies and resources can be found at a number of retailers, including the Toothbrush Rack Company and the Oral Health Foundation's Health Education Shop. The items required include toothbrushes, toothpaste, storage rack with lid, and sticker sheets. Toothbrushing procedure. Supervisor washes hands before and after toothbrushing. Under supervision, each child collects their toothbrush from the rack, or the supervisor hands each brush to each individual child. Children can be seated or standing to brush teeth. Toothpaste is dispensed onto paper towel or a clean plastic plate and applied to the toothbrush. Children brush for 2 minutes. After brushing, any excess paste is wiped on paper towel. The paper towel is to be placed in the bin. Each child rinses their brush one at a time, or the brushes can be placed in the rack to be rinsed by a member of staff. Children should not touch each other's brush. Brushes are left in the rack to air dry for 1 hour, then the lid is placed back on the rack. Paper towel is used to wipe away any visible drips on the storage system. Once toothbrushing is complete, children and supervisor wash hands. Thank you for watching. If you require any further assistance implementing your toothbrushing programme, please contact the Oral Health team.